Hi, my name is Gaston, and for my final project, I decided to discuss prostatitis. The reason I chose a specific topic was a couple weeks ago. I was circulating a case in the operating room where I work as a nurse and came across an individual who was having his prostate removed because of this specific issue. He had several procedures performed prior to this case to rule out cancer, determine what was going on, and it was difficult to identify, diagnose by the urologist why he was having his issues. So they decided, or they offered him the option to have it removed, which he chose to do. And we ran into complications we weren't expecting. Either way, it allowed me to come home and perform some research on why he was having issues, what prostatitis is, and I chose to use this as my final, or as the focus of my final project presentation. So prostatitis is it can be a variety of inflammatory disorders of the prostate gland. Either occurs spontaneously, so someone just develops an infection on their own, or it could be through catheterization or instrumentation. So someone has a urinary catheter put in or a cystoscope, they're having a procedure performed, and they go ahead and scope through the urethral opening to go ahead and look into the bladder, kidneys, etc. And even if sterile technique is abided by, somehow pathogens do work their way in and will grow, develop, and work their way into the prostate and cause inflammation. Then you have secondary, which can just be congenital defects or defects in someone's anatomy. We'll discuss this further in this presentation. The classification of the disease can be divided into four sections or four categories. You have acute bacterial, which I already said, someone either develops an infection on their own. Urinary tract infections or infections affecting the male urinary tract are not common but can occur. Then you have chronic bacterial, which tells you it's an alarm that tells you that something is going on because these are not common in males. Then you have chronic prostatitis pelvic pain, which is not fully understood. There is research on it, but it's still not fully understood. And then you have asymptomatic inflammatory, which is usually detected on diagnostic exams, studies, assessments. Maybe someone's coming in for an exam and reports signs and symptoms, but they're not really exhibiting any type of pain or issue, but they're still having abnormalities that they didn't expect. So that's how it's detected. The etiology of prostatitis is acute. As we discussed, someone can either develop the infection on their own, or it occurs through an insertion in through the urethral opening, like a catheter or a scope. It's usually gram-negative, and also can occur because there's a reflux into the prostate ducts. So the urinary tract system is lined with ducts all throughout. And when these ducts open, it allows for full emptying of urine. When that doesn't occur, or as I said, the ducts open as they're supposed to, but somehow a little bit of reflux, kind of like gastric reflux, when you feel that burn in your chest or the esophagus, somehow some of that fluid is working its way back up. And when it does that, it allows a culture and a medium for this bacteria to grow, which then will continue to grow and work its way into the prostate. Then you have chronic. It's usually to avoiding dysfunction. So somehow, again, as I said, the anatomy is wrong or off with some of these individuals. And because of that, it doesn't allow full emptying of the urinary system. And these pathogens will sit there. They'll continue to grow, usually E. coli. Also occurs in HIV individuals, can be a fungal or an inflammatory condition like sarcoidosis. But either way, this chronic issue is something, as I said, UTIs are not common in men. So something is going on, needs to be identified, and these issues work their way back up. Then you have chronic pelvic pain syndrome. It's poorly understood, but likely a result from a neurological injury or some other injury or issue that someone is born with to a neurological system, or a pelvic floor injury. So maybe someone suffers an acute, motor vehicle accident or motorcycle accident and suffers an injury to the pelvic area, and because of that, does not fully recover, and then from now on, they will have issues with their genital urinary system that results in a prostatitis. Asymptomatic, similar to those of the chronic syndrome, but as I said, they lack the symptoms reported by the individual, and these people show up, maybe have a physical exam performed, answer yes to specific questions that they weren't expecting to have an issue with, and results in a diagnosis of prostatitis. Prostatitis applies to acute chronic, as we discussed. It's often a subtype of urinary tract infection or reflux. It can be either gram-positive, gram-negative. Anaerobic are not common, but do occur. And then you have the chronic ones, which are subtle. They're difficult to treat because these men, even though you treat them with antibiotics, it's going to reoccur later on and then continue to reoccur. And you continue to treat it, but you don't see any, it'll cure for a little bit, but then it'll come back again because there's another underlying issue. These guys usually report, increased urinary frequency. They have low back pain and feel like they have to go to the bathroom constantly. Then you have chronic pelvic pain. As we said, it's difficult to identify. They report having painful ejaculation, again, lower back pain, decreased libido. Their underlying issue or cause is difficult to identify, but must be identified. And then can also be linked to chlamydia. Chlamydia is one of the most common STIs, and people who have it don't always exhibit signs and symptoms. So maybe someone had exposure to an individual who was positive for this STI in the past, and it resulted in prostatitis to them. Then you have non-inflammatory prostatitis, which no signs, no symptoms of infection, but they do have obstructions. Maybe they have a stricture or somewhere within their anatomy have something that's affecting the muscles that allow the genital urinary system to fully drain and affect their pelvic floor. And then asymptomatic again, just usually detected through routine diagnostic studies. These individuals have no signs, no symptoms at all. Again, signs and symptoms, clinical manifestation. One label may be asymptomatic, which is prostatitis with the signs and symptoms. All others will report pelvic pain. So as we said, asymptomatic, no signs and symptoms at all. All others will report pelvic pain, either pain during urinating, groin pain, lower back pain, difficulty urinating, and maybe even have discharge from their urethral opening. How do we detect this? A variety of ways. You can have your provider perform a digital rectal exam, which they will take their fingers and go ahead and enter it through the anal opening just to determine if there is an inflammation of the prostate gland. You can also have an ultrasound performed to go ahead and measure the anatomy and the measurements of the actual prostate gland to determine if it's larger than it's supposed to be. Everyone's anatomy is different, but it can be identified through ultrasound. And then there can also be blood tests drawn. So you draw someone's blood, send them in the specific tubes that need to be drawn, and determine if the prostate antigen levels are higher than they're supposed to be. And then urinalysis. So you take someone's urine, have them go ahead and urinate in a cup, and determine the specific gravity, and determine if any other pathogens are in the urine that are not supposed to be, or if the pathogens that are supposed to be are out of range. Some of the other diagnoses that can occur because of prostatitis are benign or BPH, benign prostatic hyperplasia. So these individuals do wake up frequently throughout the night and can be treated with some medications, but they wake up frequently and they also complain of and report that they can't fully empty their bladder. You have urinary tract stones, so again, kidney stones. They can, start all the way up from the kidney, work their way down to the ureter, into the bladder, urethra, and so forth. Most common, reflux. So when that urine sits there, it begins to calculate and begins to create stones. Cystitis is inflammation again of that whole area. And then you have abscesses that can form around the prostate, or other foreign bodies. The most common again is the kidney stones, but other bodies can lodge themselves and begin to create themselves within the urinary system. The possible complications are that infections, if not treated, can go ahead and work their way into the blood, which results in sepsis. You also have inflammation of the testicles. Just because the prostate is not treated does not mean that it won't be, within that specific area. It can spread into other areas surrounding the prostate, which is the testicle, also known as epididymitis. And then you have pelvic floor plane, which is, difficult to identify, difficult to treat, and then it leads to issues with ejaculation. This is the reference used, our text for the class, and this is my final project related to prostatitis.